So we're starting off today with a pretty powerful premise. I mean, the idea is that every single student deserves access to mental health support completely, regardless of, their family's income, their zip code, or what kind of insurance they happen to have.
Right, which when you say it out loud like that, it just sounds so simple. It feels like one of those foundational things we really should have figured out decades ago.
It really does. But the reality on the ground, inside the totally chaotic environment of a modern school system, is where that premise usually just falls apart.
Yeah, exactly. Because the friction between the ideal of universal access and the actual, tangled web of the American healthcare system is where families just get lost.
They completely get lost. And for you listening, that's what our mission is for today's deep dive.
Hmm.
We're looking at some incredibly detailed source materials regarding something called MentalSpace School.
Which is a K-12 mental health support initiative that's actively operating in Georgia right now.
Right. And we want to unpack exactly how this program aims to structurally erase the financial and logistical barriers that traditionally block kids from getting care.
And we really are talking about a true structural erasure here. I mean, looking at the documentation, they aren't just trying to make the barriers slightly lower. They're attempting to demolish the toll booth altogether.
I like to think of this model kind of like a public library, but for mental wellness.
Oh, that's a good way to put it.
Yeah, because a public library doesn't ask to see your parents' W-2s, right?
Mhm.
They don't check your credit score before letting you check out a book. The doors just have to be wide open.
The resources just have to be there.
Exactly. Completely independent of your family's tax bracket.
That library analogy gets right to the heart of it. Because historically, mental health care has been so intrinsically tied to socioeconomic status.
Oh, absolutely.
Like, the traditional mechanism works like this. If a family has a premium PPO insurance plan, or they have the disposable income to pay, I don't know, $150 an hour out of pocket, that child gets a therapist.
Right. And if they don't?
If they don't, that child goes on a 6-month community clinic wait list, or they rely entirely on an already overloaded school guidance counselor who has, 500 other kids on their caseload.
So building that open library means tackling the money first.
Right.
And the source materials are incredibly specific about how MentalSpace approaches this wealth gap.
It's the core of their model.
It is. The fundamental argument here is super motivational care should absolutely never depend on family income. But, saying that is easy.
Right. Execution is the hard part.
Exactly. How they actually execute it operationally is what stands out. They're casting this incredibly wide net when it comes to insurance.
And what's fascinating here is the mechanics of that alignment. It's really the linchpin of the whole program.
Because they've structured their billing so that Medicaid is accepted at exactly $0 for families.
Which is huge. But they don't even stop at state-funded safety nets. By intentionally covering this broad spectrum, they are bridging the gap between vastly different economic realities.
Let's talk about that spectrum because the roster is massive.
It really is. They're taking Blue Cross, Blue Shield, Cigna, Aetna, UnitedHealthcare.
That covers a lot of ground right there.
Yeah, plus Humana, Peach State, Caresource, and Amerigroup.
Okay, let's unpack this for a second because usually finding an in-network therapist is a complete logistical nightmare for parents.
Oh, it's exhausting.
Right. So if this program accepts all of these seamlessly, does that fundamentally shift the burden of healthcare access from the parent directly to the school infrastructure? Like, that sounds like a nightmare for the front office.
That is the exact trap most school-based initiatives fall into. And it's exactly how MentalSpace distinguishes itself.
Okay, how so?
The school does not become the billing department. The school simply serves as the physical access point, the trusted community hub.
So the principal isn't suddenly acting as an insurance broker.
Exactly. MentalSpace provides the back-end administrative engine. They act as the clearinghouse, taking on all that bureaucratic friction of dealing with, say, UnitedHealthcare's deductibles.
Or Caresource's authorization requirements.
Right. They completely shield the school staff and the parents from that whole labyrinth.
So they're essentially building a bridge between kids in the exact same classroom. You've got the kid whose parents have a premium Blue Cross plan, sitting right next to a kid who relies on Peach State or Medicaid.
And a panic attack or acute depression, it doesn't differentiate between those two economic backgrounds.
It really doesn't.
So by normalizing access across all those diverse plans, and specifically by capping that Medicaid option at $0, you remove the initial hesitation.
You remove the parent's internal calculus.
Exactly. A mother doesn't have to weigh her child's emotional crisis against the grocery budget for the month, or fear some surprise $500 out-of-network bill.
But, making it financially accessible is really only half the battle.
Oh, absolutely.
Because if a student is having a severe anxiety spiral on a Tuesday morning, telling them they have a totally free appointment in 3 months is effectively useless.
Time is often the more dangerous barrier here.
Right. Which leads directly into the speed and scope of the care they provide.
Because in adolescent mental health, a crisis really cannot be put on a calendar.
No, it can't.
When a student is in acute distress, 3 weeks of waiting translates to 3 weeks of missed classes, deteriorating grades, and escalating issues at home.
Which brings us to the operational speed outlined in these materials. They guarantee same-day teletherapy.
Which is wild.
I really want to pause on that for you listening, because in the current mental health landscape, getting an appointment on the same day you request one is almost unheard of.
It's a massive logistical flex, and it's made possible entirely by the teletherapy mechanism.
How does that actually work, though?
Well, if you rely on a traditional in-person model, you're limited by the physical geometry of the school. A counselor can only be in one room with one student at a time.
Right.
But by utilizing a dedicated digital network of therapists assigned to that specific school, they can instantly route a student in distress to an available professional within the network that exact same day.
Okay, let me push back on that a bit, though. Teletherapy for kids. We hear so much about screen fatigue and digital detachment. Does putting a screen in front of a distressed 14-year-old actually work, as well as having an in-person counselor sitting across from them?
It's a highly debated topic in adolescent psychology, for sure, but the data increasingly points to the fact that teenagers are already deeply acculturated to digital communication.
So they're comfortable with it.
Very. For many of them, a screen actually lowers the initial intimidation factor of a clinical setting. But more importantly, the teletherapy model solves a critical matching problem.
The matching problem.
Yeah. The materials highlight that the therapy teams are not just licensed, they are diverse and culturally competent.
Okay, why is that specifically called out? What does cultural competence actually change about the speed of care?
It accelerates trust. I mean, think about it. If a student from a specific marginalized background is in distress and they're forced to sit in a room with a well-meaning counselor who fundamentally just does not understand their cultural context, that student has to spend the first 5 sessions just educating the therapist. They have to translate their life before they can even begin to process their trauma.
Wow, that sounds exhausting. They have to act as an ambassador for their culture before they can just be a kid who needs help.
Exactly the problem. So because teletherapy breaks down geographic borders, MentalSpace isn't restricted to hiring whoever happens to live within a 20-mile radius of the district.
They can pull from a much wider pool.
Right. They purposefully curate a diverse team. When a kid connects with a therapist who inherently understands their background, that therapeutic alliance forms much faster.
So that same-day intervention actually becomes productive immediately.
Exactly.
Yeah.
Rather than just being an introductory meet and greet.
That makes a lot of sense. And the scope of who gets this support is actually broader than I expected. The sources indicate this isn't just a student-facing portal.
No, not at all.
The ecosystem extends to include staff wellness and family counseling.
Which is vital. Because if we connect this to the bigger picture, mental health just doesn't exist in a vacuum. A school is a deeply interconnected system.
Treating a student in isolation is incredibly inefficient if the environments they return to are toxic or overwhelmed.
Exactly.
Here's where it gets really interesting for me. They aren't just putting a proverbial Band-Aid on a student and sending them back to a burnt-out teacher. It's a 360-degree approach.
It really is an ecosystem approach.
It's like not just repairing a car's engine, but fixing the literal roads it has to drive on.
That perfectly illustrates the mechanism. If a student learns emotional regulation techniques in their same-day session, but then walks back into a classroom led by a teacher suffering from severe compassion fatigue,
the student's progress will stall.
right. And if the family at home lacks the basic communication tools to support the therapy, the progress will actively regress.
So by offering staff wellness and family counseling, they're fixing the roads.
They're attempting to stabilize the entire environment.
It's a systemic intervention. But as much as we are talking about general wellness, compassion fatigue, and daily coping skills, there is a much sharper edge to the source materials.
Yeah, we're shifting here from chronic issues to the acute life or death realities of modern education.
Right, because that 360-degree ecosystem isn't just about managing test anxiety.
Hmm.
It serves as a critical, legally mandated safety net.
This raises a really important question about how schools balance education with safety.
The services explicitly include crisis intervention alongside suicide and violence prevention, and the infrastructure is built to be entirely HIPAA and FERPA secure.
Which, for anyone not deeply entrenched in educational law, FERPA protects a student's educational records, while HIPAA protects their medical records.
And keeping those firewalled and secure inside a public school building is notoriously difficult.
It is incredibly complex.
But what really anchors this section of the materials is a looming legislative deadline. The program provides support for HB 268 compliance, which Georgia schools are mandated to meet by July of 2026.
HB 268 is a perfect example of how the landscape of educational administration is fundamentally shifting.
How so?
Well, historically, suicide and violence prevention were treated as supplementary programs, like something a school would focus on if they had extra grant money that year.
Right, and Isaiah.
Exactly.
Yeah.
But legislation like HB 268 changes the mechanism entirely. It transforms threat assessment and crisis intervention frameworks into a strict legal liability.
So the state is dictating that schools must have a documented operational framework in place to intercept these tragedies before they occur.
Correct.
But schools are already incredibly overwhelmed just trying to teach math and reading, just trying to keep the buses running.
They are stretched incredibly thin.
So if a school doesn't have a dedicated program yet, what happens if they just ignore this July 2026 deadline? Is this firm deadline going to act as the ultimate forcing function to bring in an external partner like MentalSpace?
Ignoring it carries massive risk, both legally and morally. I mean, if a tragedy occurs and an investigation reveals the school failed to implement the legally mandated frameworks.
The liability would be staggering.
Staggering. But your point about the burden is the crucial one here. Asking a superintendent to suddenly become an expert in building a HIPAA-compliant digital infrastructure for psychiatric crisis management.
It's an impossible ask.
It really is. Which is why bringing in an external partner isn't just about altruism. It's an operational survival tactic for the district.
It is the ultimate forcing function.
Yes. The deadline acts as a catalyst. The district looks at HB 268 and realizes they cannot build it from scratch by 2026.
So a partner steps in and says, we already have the secure servers, the legal compliance, the diverse professionals, and the immediate crisis protocols.
Exactly. Let us plug our infrastructure into your school so your administrators can go back to focusing on education.
It's outsourcing the legal and medical liability to the actual medical experts.
Exactly.
Okay, so we've covered a massive amount of structural theory here. We know the model removes the financial tool booth with the $0 Medicaid and the broad commercial coverage like Humana and Cigna.
Right.
We know it solves the time barrier with same-day teletherapy. And we know it handles the heavy legal lifting for compliance.
But a model is really only as good as its execution.
Exactly. What is the actual tangible impact of this model on the students themselves, moving from the theory to the documented outcomes?
This is where we see if the mechanisms actually work. And the data provided in the sources presents a very clear causal chain.
Let's walk through those numbers because they are undeniable. The source data shows an 89% improvement in attendance,
Which is huge.
a 92% reduction in anxiety, and an 85% family satisfaction rate.
Let's analyze the causality behind that 92% reduction in anxiety first.
Okay.
Anxiety is highly responsive to immediate intervention, but it calcifies and deepens when it's left untreated. So the mechanism driving this massive reduction isn't just the fact that therapy is occurring. It is the speed of the teletherapy.
Because they're intercepting it same day.
Exactly. By intercepting a student's distress on the same day, they prevent the anxiety from spiraling into a severe depressive episode or a full-blown panic disorder.
And that ties directly back into the diverse, culturally competent care we discussed earlier. The anxiety reduces rapidly because the therapeutic work begins in minute one.
Precisely. They aren't spending weeks translating their life. Now, connect that anxiety reduction to the next metric, the 89% improvement in attendance.
That is the number that administrators are going to zero in on, because chronic absenteeism is just the plague of the post-pandemic educational system.
It really is.
So what does this all mean for you, the listener? If 89%, roughly 9 out of 10 kids in this program, are missing less school because their mental health is supported. What is the direct link there?
Well, unmanaged mental health issues, specifically anxiety and depression, are primary drivers of chronic absenteeism.
It presents as school avoidance.
Exactly. A student waking up with severe, untreated anxiety physically cannot force themselves through the school doors. And traditionally, schools treat that absenteeism as a disciplinary issue,
Right, they send truant officers or issue detentions.
which of course only increases the student's anxiety, creating this vicious cycle.
So MentalSpace's model treats the root cause rather than punishing the symptom.
Yes. By deploying that same-day care and reducing the anxiety by 92%, the natural downstream effect is that the student actually feels capable of walking into the building.
It proves we aren't just solving a healthcare crisis here. We are actively solving an educational crisis.
The 89% improvement in attendance proves a foundational concept. You really cannot separate a student's cognitive ability to learn from their emotional state of being.
You just can't. And then we have that final metric, the 85% family satisfaction rate. How much of that do you attribute to the actual therapy versus the administrative model?
It's definitely a combination, but you really cannot overlook the administrative relief.
That broad insurance acceptance we talked about.
Exactly. When a family can secure high-quality care for their child, and they don't have to navigate a bureaucratic labyrinth of out-of-network claims.
And they aren't taking on medical debt because the Medicaid option is literally $0.
Right. Or their Amerigroup plan is seamlessly accepted. The relief is profound. That 85% satisfaction rate proves that the $0 Medicaid and broad acceptance is actually relieving burdens at home.
The demolished toll booth actually functions in the real world.
It really does.
So to briefly recap the core message for you as we wrap up this deep dive, MentalSpace School is providing a viable blueprint for Georgia schools.
They're proving that K-12 mental health support doesn't have to be some utopian, impossibly expensive dream.
Right. They're offering equitable care without financial barriers, using same-day care and diverse therapists to treat the whole educational community.
And they're providing that critical compliance mechanism for districts staring down severe legislative mandates like HB 268.
They've engineered a system that offloads the legal liability and the administrative friction. So the source text we reviewed today ends with a very direct call to action, and we want to relay that prompt to you.
Yeah, it's an important one.
It simply says, if your school doesn't have a dedicated mental health program yet, let's change that.
The blueprint is proven, and the infrastructure is built. It's now entirely a question of deployment.
Absolutely. So if you want to investigate their specific models or look into their compliance frameworks, you can visit mentalspaceschool.com, or you can reach out directly via email at mentalspaceschool@choltaketherapy.com.
Definitely worth looking into if you're an administrator or a parent advocating for better infrastructure.
For sure. Which leaves us with a fascinating philosophical question to end on, something for you to just mull over.
Oh, I love these.
We started this deep dive talking about a public library, how we universally accept that access to knowledge should be a given, regardless of your background or your family's income. If models like this successfully prove that we can entirely erase the line between academic success and mental health access by 2026, we have to wonder,
What's the new baseline?
exactly, will future generations look back at the idea of a school without a built-in, free-at-the-point-of-use therapy team as fundamentally absurd as a school without a cafeteria or a library?
When you view emotional infrastructure as foundational to learning rather than just supplementary, a school without it certainly seems incomplete.
It redefines what it means to build a functional school. Thanks for joining us on this deep dive.